Good afternoon, viewers, and welcome to the first public SADA webinar for 2024 aimed at educating and providing information regarding various dental topics to you, the members of the public. Today, we have the pleasure of hosting Dr. Sahide Choonara, who is an orthodontist in private practice, as well as the current president of the South African Society for Orthodontists. Dr. Choonara has also been involved in undergraduate teaching at various academic institutions, including my alma mater, and we are extremely grateful to have him with us today to speak on when to visit an orthodontist. Over to you, Dr. Choonara.
Thank you so much, Tanisha. Thank you. Welcome, viewers. The topic for today is when to visit your orthodontist. There isn't a day that goes by when parents come in and say, am I too late? Am I too early? When is the right time to see an orthodontist? And I'm often asked the question. It seems that there's a lot of sort of misinformation amongst people, both amongst patients and amongst dentists sometimes. And so the question is always, when is it the right time for you to come and see an orthodontist? Well, we go according to the specifications of the societies. According to the South African Society of Orthodontics, the first appointment at the specialist orthodontist should be before the age of 7. Now, many large international associations, including the American Association of Orthodontics, share the same recommendations. Now, you may be thinking that this is very early, but essentially, orthodontists are easily able to spot subtle problems with jaw growth and emerging teeth, while some baby teeth are still present. Although we want to see patients at this age, we seldom want to treat patients at this age. In fact, there's a lot of recent evidence that says there's limited benefits out of early or two-phase treatment in most cases. I think most patients, in any event, if you continue with a lot of treatment over many years, besides the cost implications, it's also a problem that patients become burnt out. And the worst thing you want, the least thing that you want to do is actually burn out the kid's compliance from an early age. So essentially, going forward, there's various problems that we can watch for. So I know that it's not always possible to see an orthodontist, and some patients may think, oh, the kid's already 7 or 8 or 9. Well, it's not too late still, but generally the idea is to be as soon as possible to come in to see an orthodontist. There's certain items that you see here in front of you on the screen. There are certain problems that usually warrant further investigation. We want to go through each one of them in specific so that you, the viewers, can see and make an assessment and see whether your child is in high probability that they need some treatment. Now, the first problem that we wanted to discuss is excessive spacing. I think when we see kids between the ages of 5, 6, 7, we don't want that Hollywood smile. We don't want kids to have this perfect set of teeth. So some spaces are good. But sometimes spacing can be excessive. If you look at spacing between the front two incisor teeth, if the space is larger than 2 millimeters, usually it's something that we need to keep an eye on. It may be a problem where you may have extra teeth growing. It may be a problem where the little muscle that connects the lip to the arch called the frenum might be excessive. It could be missing teeth. There's lots of different options. So the idea is if you see excessive spacing in a kid between the age of 4, 5, 6, 7, it warrants further investigation. Going forward from here, other problems that you look at is crowding. Now, crowding is defined as a severe space shortage when patients will have teeth that are literally coming out from all different areas, and it literally looks like a jumbled mess. And besides the fact that we need to address this sometimes because of the way the patient might function or we don't have adequate space, a lot of kids, when they have this problem, they take some strain. Kids are kids, and sometimes bullying happens at school, and people feel self-conscious about it. And if the case is severe enough, I mean, the first thing you want to do is just establish the right parameters for the teeth, and you want to really increase the confidence of the kids in this. Now, just a word on this. I mean, these problems that we're showing you, the idea of treatment is always to get in and get out as soon as possible. Very seldom do we want to continue for a long period of time. So if you look at a problem like crowding, very easily, within a few months, we could easily straighten out the teeth And the idea is, like in this case that I'm showing you, is literally to straighten out the top teeth, make space for the laterals or the side incisor teeth to come out. And that way it establishes functions, but also it allows the teeth to bite in a better position where they don't cause damage to each other. Another very common problem that you see often is something called an open bite. So if you look at an open bite, this is usually defined when there isn't enough vertical overlap of the teeth. So looking at the teeth from the front, you can see that the top teeth don't meet the bottom teeth. Now in this specific case, you can even see the tongue sticking out there. The problem with open bites are that open bites often are associated with habits. So it could be a thumb sucking habit, it could be a finger sucking habit, it could even be a tongue thrusting habit. Now, patients who have this type of situation often have speech impediments. So you will hear from schools nowadays. The schools are quite keen to send kids off to speech therapists if they're not communicating properly. When you have an anatomical structure such as an open bite, it's almost impossible for the kids to elocute certain words, especially the S sounds. You will see a lisp. Sometimes the F sounds, so the labiodental sounds, the fricatives, all of those sounds might be an issue. So these type of cases is one of those cases that you want to treat early. Treatment generally is individualized. Treatment has to be specific for the nature of the case, and we need to find out what caused the open bite. And generally what we will do is we will just treat the cause. There is no one-size-fits-all approach. There's no one magic appliance for this. So every case will be different. And the idea is if we are able to close the space, we're just closing the overlap. Often the tongue finds a better position, the speech is easier, and we actually helping the speech therapist help the child get proper speech going forward. Now, moving on from this, another very common thing that we would see is a deep bite. Now, a deep bite is usually when we have excessive vertical overlap of the teeth. So you can see on this picture here, you hardly see bottom teeth. And that's an indication that the bite is very, very deep. Now, the problem with deep bites is that in deep bites cases, often what will happen is the bottom teeth overgrow, they start biting up against the palate. And if they bite into the palate, sometimes kids may complain. They feel a bit of discomfort biting into the palate. But the biggest concern in these cases are, in certain cases, the lower incisor teeth, the lower front teeth can get increased wear or getting worn down as a result of this bite. So again, not every case needs treatment, but often in cases of deep bite, we would be a bit worried if it's severe enough, we may consider some sort of treatment. Now, you could see treatment was basically just to undeepen the bite. And once the bite is undeepened, we would leave the kid, we would wait until they're older, and we would see this. Another common problem at this age is something called an anterior crossbite. Now, an anterior crossbite means when the top teeth usually is supposed to be in front of the bottom teeth. In this case, the top tooth is behind the bottom tooth. Usually a crossbite is 1 or 2 or 3 teeth, not the entire arch. Now, in a case such as this, when you have an anterior crossbite, essentially what happens is the bottom tooth is starting to push further forward, the top tooth is starting to get more wear on them. And so often when we see this, we want to treat it. If it goes unabated, if it goes without treatment, you could get gum that starts receding, you could get teeth that start damaging, and these are the front teeth. These are the teeth that you smile with. So for that reason, be very, very careful. In these cases, we almost always will want to correct this crossbite. And correction, again, is simple. It's all about simple appliances. And this is the patient. And as we got it forward, again, you could see on the sides, there's still lots of mill teeth and teeth are coming out. And this was an 8-month, 9-month treatment. It's over, teeth are corrected, and that's how we leave it. Now, moving on from anterior crossbites, another type of crossbite, which is very, very common in these kids, is something called a posterior crossbite. Now, posterior basically means the back. So if the back teeth are in crossbite, this becomes a bit of a serious problem because often the top arch is too narrow. If the top arch is too narrow, the patients can't close properly, and subconsciously they're pushing their jaw to one side. So if you look to your on the left-hand side of the screen, you'll see that this bite, the bottom teeth are biting on the outside of the top teeth. Now, if a person continuously moves their jaw to the side over many, many months, there's a risk that the entire jaw starts growing crooked. So when you see a situation where you have this crossbite at the back, it's usually imperative that we treat this early. And again, we need to determine what the cause of it is, whether it's just the jaw that's moving, whether it's the arch is too small. And again, simple fix. And if you get this sorted out and we can get a better position, you'll sort of prevent lots of problems later on. So this is the same patient. It's just my camera was much nicer the second time now. So a new camera, in case you're wondering. Now, going forward from posterior crossbites, another very common case is the underbite. Now, this can't be confused with the anterior crossbite. Earlier on, we spoke about 1 or 2 or 3 teeth of the top arch biting behind the lowers. In this specific case, the back teeth bite on the inside of the bottom teeth, the front teeth all bite behind the bottom teeth. And underbite is the dental term is called a class 3 bite. Now, this is one of the few instances that when you see this, even if you see it in a 5 or 6-year-old kid, it warrants further investigation. So this is an underbite in my practice is something that I would want to treat early. There's been a lot of studies done. There was a very good study done at the University of Michigan. There was a joint study with Firenze in Italy, where they followed up patients over a long period of time. And they find that if you can treat this early enough, there's at least about a 75% chance that you can avert problems later on. And the idea at this age is to try to modify the growth, try to create the bite get the bite into a better position so we prevent things like surgery when the kids are older. I myself was a class 3, so I had surgery as an adult, so been there, done that. So this is my field of interest. So this is, I'm very, very close to my heart. So essentially, this is one of those situations that you need to see the orthodontist. If you leave it till later, you just making it more difficult to correct. In any event, the top teeth are starting to get damaged. And like we spoke earlier, the bottom gum can also recede, and that was a problem for me. Now, in an underbite case, again, treatment is specific. The treatment is meant to try to stimulate the growth of either the upper jaw, or if it's a lower jaw just to forward, there's different things. And again, your orthodontist will be well placed to show you how we can get this sorted. And again, this type of treatment correction takes 3 to 4 months sometimes. At worst case scenarios, about 9 months to a year. So this is quite a simple procedure. And once the teeth are over, we just leave the kids. We watch them periodically until they're much older. The other thing that we see often, and this is very common in a lot of the patients in South Africa with population groups that we see, overjet is defined as an increased horizontal discrepancy. So the distance between the top teeth and the bottom teeth is excessive. Now, besides the fact that, again, when you have an overjet, which is this horizontal gap here, often what happens is the kids are teased at school, and that's a big issue. But the other big issue with this is that if they fall, if they get hurt, the first thing that they're likely to hit are those top teeth. So these teeth had increased risk of trauma. Our kids are usually very active. They're playing soccer and rugby and cricket and hockey. And kids at young ages are more competitive than you might give them credit for. And often we see these cases, they come in with trauma to the teeth. In summer, they dive into swimming pools. They often knock these teeth. So when your teeth have the increased risk of trauma, that is an indication for early treatment. So if you see a child with a large overjet, we need to address this sooner rather than later. Again, treating this, pretty easy. It's to push this back, to get them into a better position. Again, we are not fussed that there are still milk teeth at the back. We are not fussed that this is not a comprehensive treatment. But by pushing those teeth back, the kid's self-esteem is increased, the teeth are in a better position, and there's less risk of trauma. Now, another very, very common thing that we see are oral habits. I mean, we have kids that suck from sucking their thumb to sucking their 2 fingers, like this picture here, to again, some people will be sucking on pens and biting on things. And anything that's in your mouth for a long enough period of time has the effect of causing permanent changes to your bite. So again, ridiculing kids, shouting at them is not going to work. often these patients, it's become a habit, it's become a learned response. And sometimes the kids need this. It's like the crutch. They need this. So when they're tired, when they're upset, when they're sibling rivalry, that's the time that the thumb goes in. And often it's subconscious. So in cases like this, simply shouting at the kids is not going to work. You can paint all sorts of things on nails. It doesn't always work because the kids will usually find a way. So often the approach to this is to work with the patients and to try to explain to them what's happening and use some sort of oral appliances that's going to help us protect us. And we find that we get very good results here. So these pictures that we've gone through is just so that you as a parent at home can have a look at the child and can see maybe there's something to look at. Again, not every case needs treatment. And so again, it's just a nice way to see things. This is not a comprehensive plan either. There are other problems that you must look at. So in cases where you have early or late loss of milk teeth, that also needs something. Often kids have extractions done at an early stage. We need to put in things to keep the space in position. And those kids need to be seen early as well. If you find that the child has a difficulty in chewing or biting, that warrants investigation. Again, if you have a suspicion that the child is bleeding from their mouth, is mouth bleeding, that's another situation where we would want to have a look at it, assess things, and often in those cases, we may even work together with other specialists like your ENTs and your GP doctors sometimes to find a cause of it and work a comprehensive solution. Unfortunately, anything that you do, any habits that you have will affect the growth of the mouth, and that's why it's important to sort this out. If you find that kids at a young age, if they open and close and they're making sounds, clicking sounds of the joint, that's usually a warning sign. We need to do that. Sometimes you have speech difficulties, although you don't have an open bite, and you can have a speech difficulty. Again, in those cases, it's something to look at. We spoke about biting on the cheek of on the cheek or roof of the mouth. If you notice asymmetry, that's a very important thing. Often kids fall and get hurt in the first year or two of life, something that you don't think about. And that can cause disturbances in growth, and you can feel that the joint actually starts growing asymmetrically. And if that happens, again, if you catch them early enough, you can hopefully arrest that to try to correct that. And again, if you grind and clench your teeth, it's something to look at. Often we don't want to treat this. Sometimes in early cases, sometimes this is just part of the transition. But sometimes if it's severe enough, we may opt to do something. So the important points to remember for you as a parent or somebody out there is that ideally the first appointment at a specialist orthodontist should be before the age of 7. However, if you've missed the boat, it's never too late. We say better late than never. So, and basically we can advise you on potential issues. There is limited benefit to early treatment. So although we're speaking about when to see orthodontists, do not mistake this for they need treatment at that age. About 80 to 90% of cases that I see at an early age, we opt not to treat. Most patients do not need treatment until they are older, and all the research is unequivocal that actually there's limited benefit to invasive and traumatic treatment at an early age. However, there are cases that need the treatment, and that's where your orthodontist can decide and do the discussion with you. Remember that early treatment is usually of short duration and limited expense. We live in times where things are expensive, and we understand that specialist care is an expensive commodity. But generally, treatment at that age is a fraction of comprehensive treatment. And often if you do early treatment in certain cases, it can lessen the severity and it costs later. If you're in doubt, visit our website, www.seso.co.za, to find a list of specialist orthodontists closest to you. And that's it. Thank you. I hope I'm within time. Thanks, Tanisha.
Thank you so much, Dr. Choonara. That was a really informative and an insightful talk. I'm sure it's going to be very beneficial to a lot of the parents out there. I just want to have a look to see if we have any questions. No, it seems we don't. Okay, so I'm going to close off the session then. Thank you once again and have a great evening further.
Thank you so much.
Thank you, Dr. Choonara.
Thank you so much.
Thank you.
Thanks.